Actually, I first heard about mesotherapy about 3 or 4 years ago, and I knew I had lots of patients that had lost weight good, but they'd have one area that they just could not seem to get it to go from. And when I heard about the mesotherapy, I thought, that's a great technique. And so I started researching it more and found out it was actually developed in France originally to treat pain problems. They were able to take medicines that they had to take large amounts by mouth to try to get at that one little sore elbow or so forth. And they were able to take the medicine and inject it right in that area around that elbow so it would be absorbed into that area and get the results locally without having to take as large and lots of times more dangerous amounts of medicine. So I researched it a little more and found out that the expert in it was Dr. Lacaze in France. And after thinking about it for a while, I finally decided, well, if you're going to do it, you might as well go to who's considered the best first to find out. And so I went over and spent about a week with Dr. Lacaze and learned the technique, and also learned that there was another expert, Dr. Patricia Reitz, who had probably done more fat type problems than Dr. Lacaze even. And so I also went and took some training from her. And what I've found is it's an incredibly effective technique if the patient will work with it. At first I had to weed my patients out, because a lot of them were coming thinking this great injection is going to do everything, and I don't have to eat right, I don't have to exercise, I don't have to do these kinds of things. And so once I learned how to convince the patient that they were doing the work, all I was doing was determining the area, we were able to start getting real good results with it. And so we started treating some different patients with it and getting some good results. And shortly after that, one of the news stations in town came to us because they had a program they had once a week where they'd take a new product, whether it was a hail preventer from automobiles or some magic wand that was going to make your food taste better, but they'd test it. And then they'd give it a ranking from 1 to 4 stars on whether it really did what they said it was going to do. And they came in and said they wanted to do a thing on the mesotherapy. And so I went ahead and thought about that for a little while, and I thought, well, if I get the wrong patient, the one that thinks the needle's going to do everything, I'm going to be in bad shape. But if I get the right one, they'll get good results. So I said, I'll do it as long as you let me interview the patient and make sure that it's a patient that I think will do what they're supposed to do. So to make a long story short, the patient that we decided to do it on was a lady that had had a few kids and had lost a lot of weight afterwards, but she got to a point where she just couldn't lose, and she still had that stomach pooch. And she agreed to do everything I told her to do, along with the mesotherapy, and have a good diet and exercise. And so we let the station film her, and we started giving her injections. And about 8 weeks later, they came back and filmed her again, and they gave us their 4-star rating, which is a rating they very seldom give. So it worked out real good there. And so we've been using it for a number of years now. In fact, I've gone around the country teaching other doctors how to do it. And we've had good results and been happy with it in the majority of patients. But I also knew that there were a lot of patients, especially men. Men are kind of needle phobic, that didn't like the needles. And so I had a friend of mine in Phoenix that is in the pharmaceutical industry, and I talked to him and discussed it with him, and we debated back and forth, well, is there some way we can do it without having to have the needles? And he said that there's a unique delivery system that he's used in some other products that he has that would make it absorb right through the skin. And so I said, well, if that's the case, then we need to use some of these ingredients that I know work and make it into a product that you can make that will be absorbed right through the skin, where they can apply it to the skin. It may take a little longer than the injection, but if we can get the same results without the injections, we're going to have something that people are going to love. And so he went ahead and developed it for me. And we've been using it in our practice, and we'll be truthful with you, we're kind of wading away from the injection technique. And I don't, I think in the future we probably won't be doing the injection technique unless it's on somebody who just is in an extreme rush. In most cases, it's not that much faster with the injection technique, using the technique we're using now with the cream. And obviously it's going to be way safer and way less painful.
So Doc, what you're saying is that if you go to that localized area, that's when you've been able to get some dynamic results. So that's what I'm thinking. Spot reduction is the first thing that comes in my mind, and the fact we've never been able to spot reduce weight loss anyway in the fields of medicine or sports or general nutrition.
Right. This is something that we developed actually as a way of hitting the exact area they're having trouble with, whether it be the little fat pads under the arms or whether it's the belly or even the double chins. And we're able to take the medicine that we had to use in large amounts by mouth to just get a little bit of effect everywhere. We're able to take smaller amounts and put it right locally where they're having this trouble and get dramatic results. But even also the fact that we can take people that have large areas and help them, because the people that have the big belly areas especially need help, because that doubles their risk, well, does more than that, in fact, as far as having heart disease, diabetes, and things like that.
You mentioned, you said the big areas. Now, you referred to that earlier as, what was it, abdominal ratio or belly ratio or belly fat ratio?
It's actually the belly hip ratio. Okay. And when you have a lot of weight in that belly area, it really dramatically increases your risk for diabetes and heart attacks. And we can attack those areas dramatically and help these people. Now understand, we're not doing it. The people are doing it themselves, but we're just directing the area that's coming from, because just like people have hormones that they put on their arms with a cream to get it absorbed, we're now able to take the same type things to help it be absorbed into the belly and put it in the belly area, or put it in the arm area or the thigh, hip, but we're able to direct it where it's absorbed right there. That doesn't mean it's not going to get some of it systemically and affect these other areas too, but we're going to dramatically help those areas that are hard to get and are more dangerous, and we can really attack those more specifically now.
So tell me, Don, what exactly happens when we put the cream? Now we're talking about a transdermal cream, this new way of delivering this same therapy. What happens at that spot specifically, without giving us too much clinical? What's happening with the fat?
What we feel is happening is that the medicine causes the fat cell wall to be more permeable, so it releases the fat better. Now once the fat's released, it's going to be metabolized and released by the liver. It's going to be burned up with exercise, or it's just going to be reabsorbed again. So this is where the client or patient has to come in and do what they need to burn that up. And all we're doing is we're helping them make it easier for them, but they still have to do their part as far as watching what they eat, because if they just keep eating the wrong things, they're going to put it right back on. And if they're not getting some exercise to burn it up, then it's going to be reabsorbed. But we're making it a lot easier for them.
So basically your formula for success is put the cream on. Now, is that once or twice a day? Is that?
We recommend twice a day, and depending on how big an area they need, an average area is going to be about like that. Now, if they have more area, they can use a little more for a wider area.
Right. So if someone's doing a love handle therapy, they would need probably 2 bottles for a 30-day supply. Is that kind of?
Yeah, just again depends on how much they have there. If they're if they're a big person with love handles, they need a little more. If they're a little tiny person that's just particular about a little tiny bulge, they may be able to use that on both sides.
Well, that's exciting, because what happens, you're telling me, is that with a little bit of exercise. Now, I'd like to talk about what that exercise is, because everybody has their own idea. When you say exercise, somebody might think that, oh, I eat a meal, then I'm going to walk around the block. and they think, well, no, I did my exercise. But that's not really what you mean, is it?
No. I'm talking about a different kind of exercise than a lot of people are familiar with. I'm talking about exercises that increase their metabolism. I don't care what they do. They can do swimming, bicycling, walking, but it has to be a fast enough rate to get the heart rate up so that they increase that metabolism. The easiest thing for a patient to think of is if they can talk to somebody next to them without getting short of breath, they're not going fast enough.
Right. And I think that most of us in the health industry would say that's about a 70% heart rate or 75% heart rate, which for me personally would be about a 130 beats per minute.
Yeah.
And that's when I know, oh, you're right, I can't speak directly with a person without being a little winded. And sometimes when I'm on the phone, I have to, tell people I'm actually working out or I'm on my exercise bike because they might be thinking I'm overly glad to see them. But with that said, so we're saying a little bit of exercise, and then we're also saying watch what you eat. Now, when you say that specifically, a little bit of guidelines on that.
Okay. Now, everybody has to understand that you have to have reasonable portions.
Sure.
But the key is to avoid sugars, starches, trans fats, and saturated fats. If they will avoid those things and just get a good exercise every day, it's going to work tremendously for them. I mean, we have seen unbelievable results on the people that followed it exactly. I mean, when you see a guy lose 70 pounds in 3 months, you know he followed it exactly. Yeah, they're going to lose inches continually, and the easiest way to describe it is they're going to put their hand on their belly fat like that, and they can't squeeze. But as they go, they start squeezing more and more, and sometimes it won't show up quite as much on the measurement because the skin hasn't shrunk up as quick yet, in older people, for example, but it gradually still does. And so it's a great way of being able to tell yourself, how the fat is disappearing.
Now, you mentioned something about the skin being resilient. We know skin is resilient, and of course there are different factors affecting that, but is there something in this formula that addresses that specifically?
Yeah, we have things in this formula that helps tone and make the skin a lot more resilient too. Lipotropics are just things that help in the fat metabolism. It's the easiest way to explain it to a person. But in our office, for example, we give an injection that contains some ingredients that help detoxify the liver and help the liver remove the fat better and metabolize it. The liver is your main organ in the body for detoxification, and it's also your main organ for metabolism of fat. And so if we can help the liver not have an overload of toxins, it makes it work better to remove the fats. If we can help the liver with the nutrients that it needs for the mobilization of fat, then it just works better. And so we give an injection in our office, but they can take it in an oral supplement. And what we've done is we've made what we call an accelerator that will have some of these same type things that we put in the injections. They're just a little higher strength because they're having to be taken by mouth. And then we also have something in there to help in the metabolism of sugar and help to keep your sugar levels more uniform so you won't crave foods. And then we also have some stuff in there to help decrease their appetite so they won't be feeling too hungry all the time. So it just makes it work even better. And some people will lose inches more dramatically and not as much weight, or other people will lose inches in weight. I think the big thing that you want is to get rid of the fat. The fat is what makes you look bad, as far as females mainly, but males too, look bad. But the fat, more importantly, is what makes you die early. And if we can get rid of that fat, people are going to live 10 years longer. They're going to live a quality 10 years longer. And that's what it's really all about. And we worked on this hard. We've tried to make it as easy as possible for everybody. And there's hardly anybody that can't do this program. Now understand, if they're going to go on any kind of weight loss program or any exercise program, they need to talk to a doctor first, make sure that they're able to do that. But anybody that's able to do that with this program, it's easy as pie. 90% of them are not a true medical cause, like a thyroid or some other medical illness. Now, people have different metabolic levels. I mean, you've seen the friends that sit there and eat all day long and never gain an ounce.
Right, just make everybody angry.
Right, you hate them.
Right.
But that's different. People have different metabolic rates, but we can affect those metabolic rates by exercising and then certain ingredients that help your metabolism as far as nutrients too.
Right.
So it's very important, to get the right kind of exercise, with it, and to do it as often as you need to make it work. It's an overall program. We depend on you to do what you're supposed to do, and we're going to give you everything we can to make it work better. The average small patient that just has one little area to do will get 5 or 6 sessions with the injectable, and they'll spend on an average probably close to $3,000 for that, which is still way safer than liposuction or something else,
Absolutely.
and way cheaper. But most people with stomach is at least 2 areas.
Okay.
In the small person that's lost most of their weight and they just want to lose the pooch, you have above the belly button, below the belly button, which are usually considered 2 different areas.
Okay.
But of course, if someone's quite large, I mean, you could get 4 different areas or more.
Right. Sure.
But the main thing is it's going to work, and that's what it all comes down to. We know if they do this program and do just a decent job of doing what they're supposed to do as far as what they eat and the exercise they get, they're going to get results. Cellulite's harder. In general, I tell my patients, you can figure it's going to take at least twice as long for cellulite, and there is nothing. Don't let anybody tell you there is. There's nothing out there that completely gets rid of cellulite. But if we can get it 50% better than what it was, I think that's great. Mm-hmm. And I've had some people. Oh yeah. But I've seen some young girls that are just beautiful, and they fit in a pair of jeans and just look gorgeous, and they come in, and I don't know why until they take the jeans off and show me the cellulite. It's way more economical, way safer, way more convenient. I mean, you do it in your own house. I mean, and the thing is, it's going to be permanent if you do what you're supposed to afterwards. Mm-hmm. And the other thing, if you want to compare it to something like liposuction, if you ever gain your weight back, it's going to come back even. It's not going to be as lumpy as it will with liposuction, for example.
Have you seen patients who have had liposuction?
Oh yeah, I've had people with liposuction in my office that we've had to try to smooth out afterwards. It's not a miracle. It's not going to get rid of all the cellulite. Mm-hmm. It's not going to get rid of all loose skin in all people.
Right.
But there's nothing better. That's all I can say. This is the best thing I've ever seen.